This is a musculature anatomy review of the shoulder with focus on additional shoulder musculature other than the rotator cuff. Most superficially and laterally is the large deltoid muscle, seen here, which is roughly shaped like the Greek letter delta. The deltoid has an origin along the lateral third of the clavicle, the acromion process, and the spine of the scapula. The deltoid muscle inserts on the deltoid tuberosity of the humerus approximately halfway down the shaft of the humerus. The deltoid muscle is innervated by the axillary nerve. And if we look at the deltoid as three separate units similar to the trapezius muscle, the anterior fibers of the deltoid act to flex and internally rotate the shoulder. The middle portion of the deltoid acts to abduct the shoulder, and the posterior fibers of the deltoid act to extend and externally rotate the shoulder. If we remove the deltoid, along the posterior aspect of the shoulder, we have the sister muscle to the teres minor. Similar to the rhomboids, the teres major sits below teres minor. Teres major has an origin along the inferior angle of the scapula and an insertion anteriorly along the medial lip of the intertubercular groove or bicipital groove. This muscle has the actions of shoulder adduction as well as internal rotation. Next, staying on the anterior aspect of the shoulder, we see two muscles. First, the coracobrachialis is highlighted here. The coracobrachialis has an origin on the coracoid process of the scapula and an insertion on the middle third of the medial surface of the humerus. This muscle, like many within the anterior aspect of the arm, is innervated by the musculocutaneous nerve and has the collective actions of shoulder flexion and adduction. Sitting superficially over the coracobrachialis is the biceps brachii muscle. The biceps brachii has 2 points of origin. First, the long head of the biceps, seen here in red. The long head of the biceps has an attachment onto the supraglenoid tubercle, which, as previously mentioned, is clinically relevant because the glenoid labrum also attaches onto that part of the glenoid fossa. And then the short head of the biceps brachii, seen here in blue, which may not be the best color, I apologize. The short head of the biceps brachii has an attachment onto the coracoid process. The biceps brachii has an insertion onto the radial tuberosity of the radius. Again, like the coracobrachialis, is innervated by the musculocutaneous nerve, and the biceps brachii acts to assist with shoulder flexion, and it also takes part in supination of the forearm and elbow flexion. Looking on the posterior aspect for our final muscle, we'll discuss in more detail at the elbow, but the triceps brachii. Although this assists with shoulder extension, it has much more important actions down at the elbow, and so we will discuss it at that point.